Small Moms Foundation began as a community healthcare project in 2016 known as Save Mothers, Save Babies, founded by Frank Jengles Banda, a former World Vision International sponsored child. Its goal was to reduce childbirth complications and encourage early antenatal care. In 2016, the organization was officially registered to enhance the well-being of mothers and children in rural Malawi through cost-effective programs developed in collaboration with the Government of Malawi, the Ministry of Health, Chingalire Rural Growth Center, Good Neighbors International, and local stakeholders. The organization's sole mission is to create a community where every child and woman has access to quality healthcare services for survival, protection, development, and participation. Shalon Makolosi is the program's coordinator at the organization, and she provides valuable insights.
Hello, my name is Sharon Makolosi, and I'm the program's coordinator of Small Moms Foundation. At Small Moms Foundation, we have several interventions that includes maternal health care, community health care, community-led acute malnutrition management, as well as community social behavior change. So, our organization covers a population of 64,374 people within 197 villages that are within TNJ, Kabudura, as well as Tegaruru. So, for us to implement these interventions, we conduct what we call coordination as well as partnership with chiefs who are the custodians of the villages and where these people come from. We also work with Salu Health Center, that is one of our stakeholders that helps us in providing us with medical staff that help us to achieve our biomedical interventions. We also work with community health workers who are known as HSAs. That stands for Healthy Surveillance Assistance. These HSAs help us in also achieving our interventions. For example, when you're having feeding sessions as well as village clinics. On village clinics, we have one which we call it Chingalire Village Clinic. We also have volunteers, community volunteers who play a bigger role in mobilization of the community and bringing people together. We also plan our programs that we should have a good outcome at the end, a good result-based intervention. So through this planning is where we have those budget, purchasing, implementation plan, as well as logistics that we have to budget for our transportation and how we can handle everything that may come within our project. For example, it is rainy season. We also have to budget how we can carry over our projects through this time of rains. Thank you.
To effectively implement her programs, the organization partnered with Insalu Health Center, which is located in Insalu within the areas of Traditional Authority Kabudula and Kalolo. This center serves a total population of approximately 63,374 people, including 14,636 mothers and girls of reproductive age. Lusungu Mike Nyoni, the facility in charge at Insalu Health Center, confirmed that since partnering with the organization in 2018, they have experienced significant benefits in various areas, including antenatal care, outreach clinics, and the provision of medical supplies, among others.
I'm Lusungu Mike Nyoni, Insalu Health Center facility in charge. The facility has around 59 villages which surround the facility, and we have a total population of 65,000. So partnership with this small mom and coming in with these outreach clinics, it will benefit a lot of the villages who are at a distance from us. So we are bringing the hospital closer to them with these outreach clinics. And as a small mom gives us a lot of drugs and test kits like the PT, which is which is a pregnancy test, and the ferrous sulfate, which they do give us. At times they do bring us laundry things like soap and other kind of stuff that helps us in cleaning the surrounding at the facility. So we really appreciate the partnership with us, with our friends, the Smile Moms. We really appreciate it.
Despite the challenges pregnant women and children face in accessing quality health care, Smile Moms Foundation, with support from Sigo Family Foundation, is working to improve early antenatal care enrollment. Long distances to health facilities and myths about pregnancy often delay timely care, which the Ministry of Health recommends should begin within the first 15 weeks. To encourage early antenatal attendance, Safe Motherhood Initiative program offers a 2-meter wrapper as an incentive for women to start their care on time. This initiative has significantly improved enrollment rates, with the percentage of women beginning care in the first trimester rising from 18% for the program in 2023 to 35% from June to September 2018, according to Taweni Nyilenda, a nursing officer at Nsalu Health Center.
I'm Taweni Nyilenda, nurse midwife technician. Smile Mom has helped us at the antenatal clinic, whereas there's an increase in the number of women starting antenatal care, especially at the first trimester. According to the data, we see that the trend has gone up. The women starting in the first trimester is very high comparing to the first months, where there was no motivation to the women, because now Smile Mom is giving rubbers to the women and they are motivated to start antenatal clinic in the first trimester. Just recently in September, we had 152 women, and out of the 152 women, 54 women started in the first trimester, which is a great improvement. Some challenges which make women to start antenatal after the first trimester mostly is due to long distances, so they just prefer to go to the hospital maybe 2 visits or 3 visits.
The Smile Moms Foundation believes that early antenatal care is essential for reducing maternal deaths and improving newborn survival rates, as emphasized by the Ministry of Health and the World Health Organization. However, in some villages around Nsalu Health Center, many challenges exist. Pregnant mothers often begin their antenatal care late because of the long distances they travel to reach the health facility, with some journeying as far as 17 kilometers to get to the nearest center. To tackle this issue, Smile Moms Foundation, with funding from Sigo Family Foundation, has expanded its efforts by introducing a monthly outreach clinic at Mom Center in partnership with Nsalu Health Center. This initiative has enabled pregnant mothers to access essential medical services in a timely manner. The women benefiting from these services come from Chimongo, Lundu, Kapichila, Chitui, Chidembwe, and Nkaliwafa villages, all located under Traditional Authority Kalolo in Lilongwe Rural. Mr. Fabiano Mangani, an environmentalist at Nsalu Health Center, explains how this initiative is making positive differences in the community.
I am Fabiano Mangani, Assistant Environmental Officer, Nsalu Health Center. Smile Moms is helping us in several activities in outreach. The main center is Mom Center at Katsuma, where several activities have been carried out, like antenatal clinic, OBD services, and 5 clinic, HIV/AIDS testing, and family planning. At Mom Center, it's almost 12 kilometers from the facility, and it's saving a total population of about 15,000. So Mom is trying to offer this service there, and helping our health facility to accomplish our plans. And other catchment areas which Smile Moms is serving is Chingalire, where they are serving village clinics, and 5 children are being treated there. And they are also carrying out community-led complementary feeding and learning session, sometimes called session. This program assists us in treating or preventing malnutrition at early stage, which helps also to prevent complications originates due to malnutrition. Other centers which these services are being carried out is Marwan, Doan, Hanga, just to mention a few. I think I must thank the spare moms for the assistance to this health facility. My role as the Assistant Government Health Officer is supervising the frontline workers in the HSS and monitoring all the activities which are being done at our facility units.
According to the United Nations Children's Fund, UNICEF, between January and June 2024, more than 1.2 million children under 5 years old were screened for acute malnutrition in 15 districts of the country. As one way of ending malnutrition, Smile Moms Foundation is implementing a community-led acute malnutrition management program called Complementary Feeding and Learning Session. The approach identifies malnourished children in communities by accessing the weight, height, and mark of under 5 children. As part of sustainability, the community members are requested to provide soya beans, maize, groundnuts, and kitchen utensils, while the organization provides sugar, cooking oil, salt, and eggs. Mr. Gary Masaje, the community health worker, sheds more light.
My name is Gerson Masaje, working as an HSA under Sal Health Center. The cooking demonstration is and it has been very good, and has been about the positive attitude to the community, mainly on how to prepare the 6 groups into one pot. And the community has welcomed warmly. As you can see, that most of the women are coming with their children. We are also including lactating and pregnant women in this program. So far and so good, this program has benefited a lot in the community. It has been tough at the first, but later on, after thorough consultations, communications, health educations, the community has welcomed it warmly. As a community health worker, there are a lot of problems and challenges we are facing in the community. One is transportation, the second is communication, and also from the community, it's all about the contribution. For this thing needs to be contribution to be happening from the community ownership. This program must be led by the community itself, but due to hunger crisis and poverty, so far the program is facing contribution challenge. That's why we are here witnessing and convince the women that they can take part in contributing for this program to benefit.
The government of Malawi has a policy requiring village clinics every 5 kilometers to provide health care for children under 5. However, financial constraints have hindered implementation. This is why in 2023, the people of Chingalire village with the Small Moms Foundation built a clinic to serve children from nearby villages twice in a week on Monday and Friday. The clinic was established to increase access to health care services as well as improve lives of mothers. This year, 2024, Small Moms Foundation expanded medical supplies to the clinic, supported by grants from the Sigo Family Foundation to reach more children and mothers. Mr. Gary Masaje is the community health worker in charge of the facility.
My name is Ngwiro from Masaja, HSA, working under South Health Center, and also working here at the Chingalire under 5 village clinic. This village clinic started way back 5-6 years ago. This initiative was sponsored by our chief, Ben Michael, who is Chief Chingalire, with the sponsorship of Simama Foundation, who sponsored the building, who constructed the building, and some suppliers here. Here is an under 5 village clinic, we especially targeting the under 5. We provide all the essential basics medicine for under 5. We treat some ailments which are under 5 programs, like malaria, diarrhea, cough, fast breathing, red eye, and also we provide therapeutic food for the malnourished children. This setup has been here for so long. I've been working here with the support from Simama Foundation, who also sometimes provide with us some medications, some kits for malaria treatment. So I'm here just to say thank you to Simama Foundation for the good gesture they have been showing, they have been doing to this community. It's part of the community mobilization and community assessment we are doing here. As a health worker, a community worker, I appreciate and be thankful to the Chief Chingalire and also our partner, Simama Foundation. There are so many things they have been doing here. I can't mention here, but I give my applaud to the Simama Foundation for the good work they are doing to my community, and also to the facility as it serves as general. So this is part of the community, as you can see, Chingalire Growth Center. That's where the under 5 village clinics is. That's where I'm operating. So I just want to say thank you to the Simama Foundation and the entire staff who are always there for me. Whenever I ask for some things, whenever I ask for medications, they usually come in time and assist the community. So I just want to show my gratitude on how the organization is doing here at Chingalire. Thank you.
Mr. Frank Banda is the executive director of the organization, and he outlines the milestones achieved so far along with future plans.
My name is Frank Banda. I'm the executive director for Small Moms Foundation. Small Moms Foundation started as a project in 2016 up to 2017. The project was named the Save Mothers, Save Babies. The main objective of the project was to increase access to early antenatal care, reduce maternal death, and also increase survival rate for newborn babies. After piloting the project for 2 years, we see the impact, and as a team, we sat down and set up an organization by the name Small Moms Foundation. So at Small Moms Foundation, we are focusing into maternal health, nutrition, community health care, as well as social behavior change. On maternal health, what we do, we have 2 approaches. The first approach we do at facility level, that's in South Health Center. At South Health Center, on weekly basis, we have 2 days for antenatal care. The first one is Monday and Thursday. So according to our criteria, we enroll pregnant mothers who are within 15 weeks of their pregnancy, that's 3 months. And why do we focus on that one? Because we also provide like health education and antenatal care for free, as well as we also provide some incentive to encourage those mothers. So we thought of targeting those mothers because in Malawi, most of the women, they don't start antenatal care as soon as they notice. Some they start at 5 weeks, 5 months, some up to 6 months. So we said no, we should cut off the delays of starting antenatal care. And the second approach is community-based antenatal care, which we conduct in the community. At the moment, we have a hotspot, that's a mom center, where we conduct outreach and antenatal care, which also target pregnant mothers and 5. They get free healthcare services. And on nutrition, what we do, we focus on identifying malnourished children in the community, and we feed them for 12 days. So what we do when we know the malnourished children, we mobilize the community. Those are mothers, caregivers, and some local leaders. They participate on the feeding session for a time of 12 days. And the feeding session is done in partnership with the South Health Center and the community. So what we do, the community, they're asked to provide some of the food materials which they have. If they don't have, like this year, you agree with us, in Malawi we didn't harvest anything. So almost every program for feeding session is 100% funded by the organization. While on social behavior change, what we do, we focus on mobilizing mothers with what we call study circles. The study circles, we deploy nurses, community health workers, volunteers, and our facilitators to conduct the health session, which lasts at least 40 minutes per session. And those sessions, they cover maternal health, family planning, nutrition, sanitation, child growth monitoring, and child development. So each village we conduct study circle once a month, and we mostly have attendance between 20 to 30 mothers per session. And we also do what we call child growth monitoring. We follow up those children which we feed them, and also those children who are able to get our free healthcare services. And the other program which we have just introduced this year is Outreach Mobile Clinic. We funded from Segu Family Foundation as well as Partners for Equity. We have introduced mobile clinics in hard-to-reach areas where we are targeting almost 18 villages. Those villages, they surround Amami Center, which is located about 18 kilometers from South Health Center. So the mobile clinic, we deploy all of the services from outpatient department. Those are malaria tests, HIV tests, family planning, antenatal care, nutrition, everything we provide for free in the community. And roughly we meet 160 to 180 patients each day when we are conducting mobile clinics. In terms of the total population which we are saving about 64,374. That's the total population surrounding South Center. So we are working in 2 tiers, that's tier Kapundura and the tier Karulu. In terms of the challenges, we are facing a lot of challenges. The first challenge is lack of capacity. We need to have a good talent team which can help us in terms of project designing, project implementation, resource mobilization, communication, as well as policy development and enforcement. The second one is high inflation rate in Malawi. Our economy is not stable. For example, last year we had a devaluation. This year we had a devaluation again, which compromises whenever we are purchasing like materials like medicine, also like logistics support to carry out our intervention. And the third one is the poor transportation. At the moment, the office doesn't have office vehicle, of which we depend on hiring cars, which is very expensive. For example, on daily basis, we spend $100 to $120 to hire a car and put fuel to go to the community, which is a bit high, and it also affects our budget. The other challenge is tradition. Most of the communities here in Malawi, they don't encourage male participation. But as an organization, we are trying to break those barriers. We are encouraging the chiefs, religious leaders to promote male involvement in self-mother, because most of the maternal deaths which occur here in Malawi are preventable. We just need to have knowledge from the facility, from the health workers, to the community. So we are using those local leaders, church leaders as a vehicle to drive the information to the community. In terms of partnership, here at Small Mountain Foundation, we always value the partnership from the community up to the national level. So at the community level, we work with the South Health Center, that's under Ministry of Health, and Chingalire Village Clinic, and also Good Neighbors. Those are the partners who help us to drive our impact. And whenever we are implementing, those stakeholders, they are always there for us, and they always help us in terms of technical support, materials, and the like. For example, if we are implementing mobile clinics, we find that we need the anti-malaria drug, which is very expensive, but the government, through South Health Center, they are able to provide malaria treatment. As an organization, we're just focusing on painkillers, antibiotic, and the other logistics to support the intervention. Yeah, at a national level, we have been supported by SEGO family from US and Partners for Equity. Their investment mean a lot to us because we are trying to drive the impact to almost every village which is around the South Health Center. If you go out talk about Small Mountain Foundation, they say, we know those guys, we are into this field and the like. And also we partnered with Malawi Scotland Partnership, which during their meetings we learn a lot. We check some collaboration, and we do believe that in future I think they will start giving us funding. What we believe at Small Mountain Foundation, we believe every partnership should embrace the change in the community. People should be able to see where they are coming from and where they are, and appreciate that because of this partnership we are able to achieve this. Additionally, we have big plans. Like in the next 5 years, we are planning to have a rural clinic where people can come and get all of the services, because we are trying to close the gap between the health workers and the community. So we are creating a good communication with the health workers and also increase access to healthcare services. Yeah, I think that's what we can say.
We believe that mothers and children deserve the opportunity to lead fulfilling lives. The Small Mountain Foundation's interventions in Insalu, Lilongwe is based on this belief. Many villages we serve struggle with poverty, putting pressure on families and jeopardizing the health of mothers and children. Despite these challenges, we see many opportunities to help families escape poverty. Our vision is for every mother and child to live a fulfilling life, and we are driven by our faith. With support from the community, donors, the Insalu Health Center, and our staff, we aim to do more than just help the poor.